Hi. Today we're here at Dr. Jonathan Greenburg's office, and we're talking to Rita, who is a patient of Dr. Greenburg's and who treats sleep apnea and snoring. Welcome, Rita. It's a pleasure to have you. Thank you for coming. We want to talk a little bit about your how you were treated and what made you realize that you even had a problem with sleep apnea. So tell us a little bit about your story.
Well, I guess I had a problem a long time before I really realized I had a problem. I had fallen asleep driving the car.
Oh dear.
And my husband had tried every possible way to stop me in the middle of the night, poking me. I was black and blue, banging on the wall. He'd do everything.
Oh dear.
And finally, I had gone through 3 sleep apnea tests, and I was classified as a severe sleep apnea case. And my ENT said to me, you know, you don't realize how serious this is. You could die from this. And I said, oh no, I can't. And he said, oh yes, you can. He said, I've heard of this doctor, this dentist that just had moved into the area. He said, why don't you go there? And I was driving home, and all of a sudden I realized, oh my God, you know, and I drove right up to Dr. Greenburg's office. I walked in and I said, I need help. And that's how it all started.
So your ENT told you that you could die.
Mm-hmm.
And a lot of people don't realize that sleep apnea can cause strokes, can cause heart attacks, it can cause a lot of internal damage from the fact that you're not actually breathing.
That's right.
So you came in, you met with Dr. Greenburg, and he shared with you about some of his treatment. Had you been prescribed CPAP or at that point, or?
Yes. Every test that I took, they tried a CPAP on me and told me in the morning that all I did was fight. And I was trying to rip it off, and I couldn't wear it, and I didn't want to wear it. My husband didn't want me to wear it, and I wasn't going to wear it, and that's all it was to it, and I was going to be fine.
So there had to be something other than CPAP for you. And so when Dr. Greenburg showed you that there was an oral dental device that you could get treated with, tell us how that worked. What was your experience with that dental device that Dr. Greenburg worked on?
I was absolutely thrilled that if I traveled, I just stuck it in my little retainer case and went on my way and didn't have to bother about anything else. It took a little while to get used to it. It was kind of tough, and I wasn't used to something holding my tongue down, but it took a couple of weeks and I was fine, and my husband was delighted. He could not believe that. He said, you're not snoring, and it was just absolutely amazing.
So it actually helped your marital relationship.
Oh God, yes.
One of the added benefits. All right, one of the ones that don't really get talked about much. But so before intolerant to CPAP, looking for another solution, Dr. Greenburg's patent pending oral device, you were able to use that. You take it traveling, and how about how you feel? Did you experience any difference in how your day went the next day?
Absolutely. I was always falling asleep during the day, and I didn't realize that that had anything to do with my sleep apnea. In fact, the first test that I had taken, they asked me in the morning, how many hours do you think you slept? And I said, I looked at my watch. I knew when I went to sleep, and I knew when I got up. So I said, oh, I slept 7 hours. And the guy said to me, oh, that's very interesting. He said, you had 2 hours sleep. And then that made me a wake-up call to the fact that I was tired all the time. I never could stay awake during the day, and that made me realize that I wasn't sleeping, and I thought I was sleeping, and I thought I was fine, but I wasn't.
So it's really important, and the reason that you're even here to do this video and letting the people know is because you feel that it's really important for people to know that this is something that can't be taken lightly. That you're actually helping people save lives, save their lives.
I do. I tell everybody that. Anyone who tells me I use a CPAP machine, I say, you travel with it? And they, oh yeah, it's such a pain in the neck. And I tell them, you want to put it in your pocket? And I tell them that, Dr. Greenburg. In fact, I told somebody who lives in Tennessee, and he said, well, who do I call out here? And I said, you can't, you have to come to California. And that's the problem.
Good reason to get your friends out to California.
Yeah, that's it.
So if you're looking for a solution to replace your CPAP or your snoring, and you'd be tired all the time. You're not even really thinking about why you're tired. You just feel like you're getting older. And it's not really because you're getting older. It's because you may have sleep apnea. Come in for a free consultation, just like Rita did, and get your treatment, get your consultation. Do something about it. Don't put it off. It's really important. Call 888-31-SNORE And make that call today. It's 888-31-SNORE. And do what Rita did.